Let's talk about something a lot more pleasant, and that is an event out at the University of Pittsburgh this afternoon. Public health leaders are going to be signing the final construction beam on Pitt's Graduate School of Public Health's new 4-story laboratory pavilion, 58,000 square feet of lab space, and a 215-seat auditorium. It's going to be completed in the fall of next year. And among those signing the beam, Dr. Peter Salk. Dr. Salk is the eldest son of Pitt's researcher and polio vaccine pioneer Jonas Salk, who led the Pitt research team in developing the vaccine that nearly eradicated polio. Dr. Peter Salk is a graduate of Harvard University and the School of Medicine at Johns Hopkins. He worked with his father's laboratory at the Salk Institute and has been working on a vaccine for HIV infection and working on the introduction of AIDS treatment programs in Africa and Asia, and is also trying to come up with an affordable and accessible polio vaccine for people in developing nations. Dr. Salk, good morning. Thanks a lot for talking with us.
Good morning. Pleasure to be here.
Sure. Tell us about the pavilion. Why is that important?
It's important because the Graduate School of Public Health, which interestingly enough had its birth in the same year as the work on the polio vaccine, 1948, has been operating out of two buildings that have never been renovated in their history of since 1957 and 1966. This is a major step to add new laboratory space and to bring up to standards. Actually, they're looking at achieving Gold LEED certification. The existing buildings, making them really user-friendly to encourage collaborative interactions among people working in different areas, and to be able to attract the highest level of both students and faculty to this new physical entity.
Yeah, you hear a lot about that these days. People in various disciplines working together, so to speak. You have an engineer and a writer, for example, working on some sort of a project, not just in medicine, but in other fields as well. Is that something new in your field, or has that been going on for a while?
In public health, this is the necessity. People from different areas with different responsibilities working together to address public health problems.
Tell us about your work on HIV. What is the state of HIV in the United States right now?
Well, it's interesting because my father wanted to try an old approach as a new approach to an HIV vaccine, and to work on a kills vaccine, same thing that was done with polio vaccine, to apply to both treatment and prevention of HIV/AIDS. That project, though, I think has a bit more that needs to be done with it. But what interests me primarily is the other work that he was wanting to see for the world that had to do with the broad range of problems that would be seen under the rubric of global health.
For example, give me an example of what you're talking about.
Okay, so if you think of global health, and public health is embedded in global health. We're at a point in our human experience now where we no longer can see ourselves as isolated. Anything that happens to anyone anywhere is something that has repercussions on a global level. So when we think of global health, we no longer can think only in terms of particular diseases like HIV/AIDS, tuberculosis, or polio. We have to be dealing with the entire complexity of our experience on this planet, which includes issues such as poverty, war, environmental degradation. All of these things have an impact on us as individuals in terms of our health and our well-being, and as a society.
That's interesting. Listen, thanks a lot for talking with us. Good luck with the new facilities out there, the new lab space and the like, and thanks again.
You are very welcome.
Dr. Peter Salk on the live line, and he's going to be among the many out at the Pitt campus today signing the final construction beam on Pitt's Graduate School of Public Health's new 4-story laboratory pavilion. Time now 11:37.